Survival in patients with glioblastoma receiving vangalciclo. Definition: glioblastoma is the most common tumor of the central nervous system and the most malignant type of astrocytoma, grade 4. The cytomegalovirus is a type of herpes virus that usually helps the genes P53 and NF1 to produce glioblastoma. The vangalciclovir is a drug that sees the DNA synthesis and stops the replication of the herpes virus.
How do they present? Well, they can present with any of the signs associated with pressure or occasionally sudden hemorrhage within the brain. So signs of pressure would be things like headache, sometimes visual loss or blurring, weakness on one side or the other of the arms or legs. Sometimes it'll be something that happens much more suddenly, such as a seizure or even a loss of consciousness. These are all reasons to see a doctor.
Symptoms: glioblastoma symptoms may include seizure, focal neurologic deficit, like weakness or speech problems, headaches, personality changes, and visual loss. Diagnosis: magnetic resonance imaging (MRI) is the preferred imaging technique for diagnosis. An actual tissue biopsy is typically required for definitive diagnosis. Pros: in an animal model, anti-CMA treatment reduced the growth of medulloblastoma by 72.4%. The patients who were treated for compassionate use had good neurological function and either approached their doctor and request vangalciclovir or learn about this option from their treating physician. Cons: in the valside treatment of glioblastoma patients in Sweden study a double-blind clinical trial of vangalciclovir involving 42 patients with glioblastoma. Researchers found that tumor growth, the primary endpoint, was not significantly reduced at 3 and 6 months after surgery. Also, there are some side effects of the vangalciclovir, like any drug. The most common are blurred vision, chills, cough, dizziness, fever, headache, hoarseness, lower back or side pain, nervousness, painful or difficult urination, pale skin, pinpoint red spots on the skin, pounding in the ears. Cytomegalovirus is a spread through body fluids and sexual contact, blood transfusion, and organ transplants. Cytomegalovirus can be detected by testing blood and tissue samples, qualitative polymerase chain reaction (PCR) test, and cytopathology. To treat patients infected with CMA-P, especially the high-risk ones who has organ transplantation, antiviral drugs such ganciclovir, cytovan, and vangalciclovir valsite are used. That's all. Applications in medicine. Vangalciclovir can be used to treat any virus from the herpes virus family, including the cytomegalovirus. It must be taken after the meals because it can laser the mucus, and the patient should rest because of the side effects. The renal function has to be controlled, and dose needs to be adjusted according to this.
Well, you probably know these symptoms. Severe fatigue, is a specialist in infectious diseases, and he's not great ways to diagnose it, and we haven't until recently have great ways to treat it either. So it's been a little bit of a medical mystery, so to speak.
Does it tend to get to a fairly advanced stage before it's diagnosed? Is that the problem?
It's pretty variable. Part of the problem is that there's these overlapping symptoms that are very general in context, like you said, fever, joint pain, swelling, lymph nodes, sort of flu-like symptoms that are maybe sort of the worst flu you've had. Oh my goodness. So, you know what, the way you say chronic fatigue syndrome, it just sounds like you're tired, but it's actually much more serious than that. That's right. I mean, these are symptoms that go on for months and even years at a time. People can be bedridden all the way to, losing their jobs, becoming CDC and others haven't really figured that out yet directly, but what we think is that there's some viral triggers that are going around that have been doing this for many years, and that really puts all of us at risk to a certain extent. So is it like contagious? There's a factor of that in there, certainly. Okay, and what about kids? There's some suspicions that kids are diagnosed, but they don't know they have it. Yeah, we have our age ranges for patients. Exactly. There's been a lot of implication around some of the various herpes viruses, so Epstein-Barr virus, immune system that are happening either because of these organisms or because of other pathogens that are out there. Right. Do you think it's preventable? That's a great question. I don't think we know enough about it yet to really answer it. But there's
Applications in Ecuador. There are many alternative treatments for the glioblastoma, which include surgeries, stereotactic biopsy, and cytoreduction and radiotherapy. Conclusion: vangalciclovir is a good treatment option for those patients who already received surgery and still have problems, and for those who have to wait for surgery because it reduces the velocity of cell mutation. Thank you.